Today we're going to talk about catatonic schizophrenia. We're going to go over the etiology, the signs and symptoms, the diagnosis, and the treatment. So as far as etiology, experts, can you go forward? Okay, so for etiology, researchers are unsure why the brain dysfunction occurs, but theorize that it is likely due to genetic factors and neurotransmitter dysfunction. So experts believe that it's an imbalance of dopamine, which is involved in the onset of all different subtypes of schizophrenia, and they also believe that serotonin levels are part of this. So the combination of genetics and these two neurotransmitter dysfunctions are theorized to be the result of this deterioration of the brain. And go forward. As far as signs and symptoms, the patient will have a waxy flexibility, which is defined as if you move a patient's arm in one position, they'll remain in that position until it's moved again. So they kind of go into a paralyzed state. They can also have catalepsy, which is they adopt unusual positions. Agitation, negativism, grimacing, mutism, which is inability to speak or respond, and mimicking others' speech or movements. So in order to have a clinical picture of catatonic schizophrenia, the care provider has to see at least 3 of these symptoms in order to be considered this diagnosis. So now we're going to go into, and there is a picture of a posturing position. They go into a position and cannot move. And then we're going to go into the diagnosis.
And when a schizophrenic patient presents with catatonic symptoms, the provider must first rule out other underlying causes, such as neurological disorders, substance abuse, and other mental health disorders. This is accomplished through a physical examination, lab work, MRI and CT scan to check for abnormal brain function, or structure, and then an EEG to check for abnormal brain function. And the patient will also go through a battery of psychological evaluations. The next step in confirming catatonic schizophrenia is to diagnose for what is called, or do a treatment to diagnose for what is called the lorazepam challenge. The provider would examine the patient and then request that 1 to 2 milligrams of lorazepam be administered IV, and then wait 5 minutes and reassess the patient. After 5 minutes, the provider would re-examine the patient, and if no change in the symptoms, a second dose of 1 to 2 milligrams would then be re-administered. Another 5 minutes would pass, and then the patient would be reassessed again. At that time, if the patient truly has catatonic schizophrenia, there would be a reduction in their symptoms of 50%. That would confirm a positive response, and the diagnosis of catatonic schizophrenia would be appropriate. Once the patient is diagnosed, next comes the treatment. So given what we just talked about with the lorazepam challenge, you can surmise that the first line of treatment would be benzodiazepine, which is Ativan lorazepam. The drug acts to depress the central nervous system motor control for the catatonic patient, thus is why they have a 50% reduction in their symptoms. Once the patient is past the crisis, they can be slowly weaned off of the benzos and then possibly try a maintenance dose to prevent relapse. If the patient does not respond to medication, there is research to suggest that electroconvulsive therapy, ECT, may work to decrease some of their symptoms, but this is not the first line of treatment. Patients who are experiencing severe symptoms may require hospitalization for safety and also to make sure they are getting the proper nourishment. Patients will also benefit from psychotherapy, social and vocational training in order to promote independent living. And the most important thing is to have a strong support system for the patient, as far as family and friends or both, who are willing to step in and help the patient out when in need, and to monitor them for their symptoms, and also just to make sure they are taking their medications as well. And then we have a question for you guys.
Oops.
And so there's the question. A newly admitted patient can't take care of his personal needs, shows insensitivity to pain, stimuli, and exhibits negativism. The nurse would classify the patient in which subtype? Paranoid schizophrenia, residual, catatonia, or undifferentiated schizophrenia? And the correct answer is C, which is bolded, catatonia schizophrenia. And there's our references.
All right.
Welcome to Delusional Personality Disorders, a casual conversation with Grace and Danielle. So Danielle, do you know anything about delusional personality disorders?
I know a little bit. I know it's a mental disorder. It's characterized by having 1 month long of delusions, but without other psych disorders, such as a mood disorder, hallucinations. And I know that no matter, you can show them as much evidence as there is against their delusions, but they're still going to believe it.
So they will absolutely believe that this is going on and there's nothing to convince them otherwise?
Exactly.
Okay,
Yeah.
that sounds interesting. Do you know about the etiology?
Not really. I know that there's, let's see, I know that the exact cause is unknown, but do they have sort of ideas about it?
They do. Some of the things that can happen could be a genetic predisposition, physiological disorders, psychological issues. Drug abuse can certainly lead to a delusional personality disorder, along with certain medications and toxins. I know that when my dad was on some medication, he started to have some delusional disorders.
Oh, really?
Yeah.
Oh, that's interesting.
Did you know that there are 5 types?
I did.
Do you want to talk about them?
Sure. So the first one's called erotomanic, and it's the delusion that you have a special loving relationship with another person, usually a famous person, higher standing, and they don't know that you exist.
An excellent example of this is John Hinckley. He was absolutely in love with Jodie Foster, and this took place in 1981. He would write her letters, and he believed that they had a special loving relationship. To prove his love to Jodie Foster, he attempted to assassinate Ronald Reagan.
Oh.
And she had no idea any of this was going on. So he was arrested, of course, and convicted under a mental disorder, which was the erotomania.
Oh, wow, that's so interesting. I
Yeah,
didn't know
so
that.
that's an actual figure of someone in history that suffered from that.
Interesting.
Yeah.
And then there's another one, it's called grandiose, and that's when the person has a delusion that they have a special power, special ability, or they have a relationship with a person in power.
Do you know anything about that creeper?
No, who's that?
That's David Koresh. He was the leader of the Branch Davidians out of Waco, Texas, and he had a special relationship with God, which many people do have a relationship with God, but he also thought that he was a bit of a god. He thought he was a Messiah, and he was here to bring the word of the apocalypse, and that the world was coming to an end. Unfortunately, he developed a cult. Many people believed him, and ended up dying.
Oh, that's really sad.
Yes, but he definitely had the grandiose personality disorder where he felt he was godlike, and you could not tell him otherwise. I mean, that's what he believed.
Wow,
Yeah.
that's interesting. And then there's also the jealous one, which is where you believe that a sexual partner is being unfaithful to you. And when I was in clinical, I actually kind of experienced this with one of the clients they had there. He believed that his wife, or at night he would have delusions that his wife was cheating on him, so he would call her hundreds of times in the night. So they would have to take his phone because she wasn't cheating on him, and it just caused a lot of issues. He wouldn't, in the morning he wouldn't believe that, he just had the delusions at night.
Oh, really?
Yeah.
Oh,
so-
that's very strange.
Yeah, quite interesting.
Yeah. Do you know about the persecutatory?
No.
Okay, so this is the most common form of delusion.
Okay.
It's a delusion that a person is being threatened or maltreated. Kind of an example that I think of with this is, like, in the nursing home, I would hear patients be like, oh, they chained me up, last night and I haven't been fed any food for 20 days or, something like that. And of course that concerned me and I'd have to go ask the nurse, and it was just a delusion. It was not actually taking place.
It's sad because they actually believe that.
They do, and
Yeah.
that's one of the things about delusions is you cannot tell them otherwise. That's what they believe.
Yeah, that's really hard.
Yeah.
So then the last one that there is called somatic, and that's when you believe that one of your bodily function, sensation, or appearance is grossly abnormal. So an example of that would be like if you believe that you have parasites crawling all inside of you, or there's another one.
Would it be like maybe if you thought you had cancer all inside your body?
Yeah, despite no one's ever told you that before, you just believe that you do.
Yeah, and I've also been told that people could show you proof, like they could show you an x-ray of your lungs and be like, there is no cancer in this x-ray, and the person will still not believe it.
Oh, wow.
Yeah,
That must be hard.
I would imagine.
Yeah.
You want to talk about treatment?
Sure.
Okay.
So treatment for this disorder is really tough because the people who have these delusions, they fully believe that they're real. So it's hard to get them treatment because if you don't think anything is wrong, you're not going to see what's the point of going to treatment.
Yeah.
So it's hard. I mean, they have had some success with psychotic medications, but other than that, if you can try and get them into therapy, that's your best bet, and just support the family and friends, help them understand that they really do believe these things are real.
So a lot of family education.
Yeah, a lot of education. Let's see, just trying to point out the difference between symptoms and reality to the person.
Yeah.
But
Danielle,
it
do
can be
you see
hard.
what that is?
Puppy.
Yep, every good presentation has a cute puppy.
Yes. All right, Grace, it was nice talking to you.
Nice talking to you. Cheers.
Cheers.
Okay. Hi, Grace. How are you doing today? Can you tell me what's going on?
God, I'm not really doing very well at all, and I need help. There is something very wrong. I've been hearing voices, and I know that someone's trying to hurt me.
Okay, well, can you tell me a little more about who's trying to hurt you?
I'm concerned it's the government. I know that they're watching me. I have a TV, and when I turn it on, a red button comes on, and that's a recording device. I also have a modem in my house, and when the light flashes, I know that they're recording me on that too, so I'm not safe in any of my rooms. I know that they want to harm me, but the voices, they told me that if I board up my house and I get rid of the listening devices, the modem and the TV, that I might be okay.
Okay. All right, well, Grace, you are showing symptoms of paranoid schizophrenia,
No.
and you experience delusions and auditory disturbances. It's common for you to believe that others are trying to hurt you, and there is no known cause for schizophrenia, but it is believed that it's caused by a chemical imbalance in your brain. So the treatment for schizophrenia is lifelong commitment because there is no cure, but there are antipsychotic medications that can fix that chemical imbalance in your brain, and there's also psychotherapy, which has shown to help develop and retain social skills and improve relationships with loved ones and friends. I know this is a lot of information to take in, and we have some pamphlets for you to take with all the information you need, and we will be with you every step of the way, okay?
Okay, I'm gonna have to look at that because I think the government might be making the pills that you're talking about,
Okay.
but I'll look into it.
Okay, we'll be with you if you have any questions, okay?
Okay, sounds good.
All right. So with paranoid schizophrenia, there is no clear understanding of what causes it, but it's known that there is an imbalance in brain chemicals like dopamine and serotonin. It could also be due to genetics and environmental triggers. Some of the risk factors are family history of mental illnesses, there's exposure to viral infection in the womb, there's fetal malnutrition, stress in early childhood, sexual or physical abuse. If your parents are older, when they got pregnant and had you, use of psychoactive drugs during adolescence. Some of the symptoms are delusions and auditory disturbances. Delusions are firmly held beliefs that persist despite evidence to the contrary. Hallucinations are seeing or hearing things that others don't, and they can both be threatening in nature, so telling you to do bad things or hurt others or hurt yourself. So for the treatment, as we mentioned, there's antipsychotic medications that change the chemicals in the brain, and there's also therapy like cognitive behavioral therapy, which helps improve skills and relationships. And then we have a question. So Sam, who has auditory hallucinations for many years, tells the nurse that the voices prevents his participation in a social skills training program offered at the hospital. Which intervention by the nurse is most appropriate? So A is let Sam analyze the content of the voices. B, advise Sam to participate in the program when the voices cease. C, advise Sam to take his medications as prescribed. Or D, teach Sam to use thought-stopping techniques. And the answer is D, to use relaxation techniques to help reduce his anxiety. Okay.
So, hey, April. So I heard in class we're going to start learning about schizoaffective disorder. And I looked into it a little bit. I heard one friend told me, I was talking to her, and she had said that it's kind of like schizophrenia and bipolar disorder had a baby. But I haven't been able to look into kind of what, how you get it or what they think causes it. Have you done any research?
Yeah, so I actually found an article that was published in 2015, and it talks about how the brain changes with people with schizophrenia, bipolar, and schizoaffective. And it actually looks at kind of the differences between them. So when you have schizophrenia, your brain matter actually, it's decreased overall by 2%, and there's actually changes in the hippocampus and the frontal lobe. And bipolar, and not so much. The brain isn't quite changed as much, but schizoaffective, that brain looked a little bit more like the schizophrenic brain than it did the bipolar brain.
Okay.
And a lot of doctors, there's been a lot of controversy about what category it should be in, if it's more bipolar or if it's more schizophrenia. So this actually was really interesting to find that there's actually research that shows there's actually differences.
Yeah, but it is more like a little bit closer to schizophrenia then.
The brain actually looked a little bit more like schizophrenic than it did
Okay.
bipolar.
Okay.
Yeah.
And then also, is there because I know in schizophrenia there's a genetic component in there. Do they think the same thing with schizoaffective disorder?
Right, yeah. So
Okay.
schizoaffective, the genetic component, if you have schizophrenia or bipolar, you're more likely to have schizoaffective.
Okay.
There
All
is that
right.
genetic component as well.
Interesting. So with schizoaffective disorder, I heard then since it is kind of like schizophrenia and bipolar, it's almost you can get a number of different things going on. So you can have hallucinations like
Right.
schizophrenia. I've also heard that a lot of times they're a little more auditory than like visual hallucinations, but I think in schizoaffective disorder you get both. Some delusions, and then there's two different kinds. So you can get schizoaffective disorder and you can be manic and have, bipolar, and you can have the manic and depressive episodes, but then you can also just be depressive schizoaffective disorder, which is just the depressive side, and you don't have those manic episodes too.
Right.
Is that kind of
Yeah.
what you heard too? So you still have the euphoria if you have the manic, and you get that, kind of risky behaviors. But then if you have the depressive kind, you're just really feeling bad about yourself all the time and kind of just down, worthless. You can get really, really sad.
And to be diagnosed, you have to have the psychotic symptoms of schizophrenia, as well as either the depression or the manic depressive type of stuff.
Okay.
Yeah.
So I had focused a little bit more on the treatment aspect of it, and I had looked into some medications and other things that they use to treat it. So like we were talking about with having the two different kinds, if you're schizoaffective with the bipolar, they can give you mood stabilizers to help you with that. But both kinds, the bipolar kind and the depressive kind, you're on antipsychotics no matter what, because both of them have that schizophrenia aspect. So they still need those antipsychotics to help them.
Right.
But if you're bipolar, you're on the mood stabilizers, and some of those are valproate and then lithium as well. And lithium's kind of one that you have to work with for a while to get that right dose. And then if you have the depressive kind, you're on the depressive antidepressants like sertraline or fluoxetine. But some other things that I found out that they do is some psychotherapy. So a lot of times they, do like group therapies or family therapies, because a lot of times it's really hard for families to kind of understand if they don't have it in their family already. So they'll do family therapy sessions and things like that. And then just really understanding the disease is important for the person to realize what's going to work best for them, because everyone's going to be a little bit different, especially with schizoaffective disorder.
Exactly. And of course you want to avoid alcohol and drugs and high stress situations, because those can actually trigger symptoms.
Okay. Yeah. Well, great. I feel like we really learned a lot today.
Yeah.
And thanks for kind of talking me through it.
No
I
problem.
appreciate it.